All right. Let's go ahead and call the meeting to order. First up is approval of the minutes. Council members Coombs and Bergan, any changes on the minutes, and are you okay with approving those?
I was absent, I believe, the last meeting.
And I don't have any changes.
Okay. Minutes are approved. And then before we move into the agenda, item 4D is going to be removed and delayed for 30 days, so that we will not discuss that one today. First up, Bill Levine, sales tax review.
Good afternoon, committee. Bill Levine in the budget office. Sales tax collections for August 2025 were 25.2 million. And that number was a little less than $800,000 below what we collected in August 2025. So that's the far right column. That's a 3% reduction compared to what we collected a year ago. I guess I have two quick points I wanted to talk about in understanding that number. The first one, and it may help a little bit on the chart that you see. If you look a year back to August 2024, so sort of in the middle of that graph, you're going to see that we had a really, really good month in August 2024. So in that month, we had really strong variable sales tax collections, so those large one-time business-to-business payments. We had about a 75% increase in August 2024, so that made that a good month. And the other thing that happened, I know when I looked at the sectors, we had a very strong month for utilities. So I'm guessing some combination of a really hot summer and high energy prices meant utilities were collecting a lot of money. And so that drove August 2024 to be actually the second biggest month of collections last year, which was pretty unusual. Typically, our biggest month is January. In January, we get holiday sales, we get annual payers, quarterly payers, monthly payers, all making payments in January. So January is always the biggest month. Typically, your next biggest months are the end of the quarter months. So April, July, October, because we get not only monthly payers, we also get quarterly payers. So August snuck in there as a month only with monthly payers and was the second biggest month. So again, just trying to emphasize that August 2024 was a really good month, and that made it very hard for us to compete with that this year. So putting that 3% decline a little bit in perspective, we had a very high bar to clear given how good August 2024 was. So we were 3% down. That being said, there are two things that were areas of a little bit of concern. First one is that variable sales tax were down. So again, we had great variable sales tax a year ago. This year, not as good. They were down about 225,000 or about a 17% decline compared to a year ago. The other thing to say about August 2025 is that when you look at the collections by sector, we had 9 of 15 sectors showing declines in August. So again, I'm not trying to make it sound like it was a good month, but it wasn't as bad as it seems either. So with those perspectives, I am done with my presentation, but I'm here to answer any questions that the committee may have.
Great. Council members Bergan or Coombs, any questions?
Just one. Thank you for the presentation. Do you track the internet sales by category?
So the internet sales, or I call those online sales, and I track that not as a sector, but so just to take a random example that comes to mind, Chewy.com sells pet food. I end up including that in other, and I have some online clothes retailers. I track those as clothing retailers, etc. That being stated, in my own analysis, I have a separate, and I hate to be geeky, it's just who I am. I have a separate tab on my spreadsheet where I actually do roll together all of the online sales so that I can look at a group, and I think it's about a dozen. And I can just track, hey, are those growing? Are they not growing? What are they doing? So I don't treat it as a sector. And when I say that 9 of 15 sectors are down, that's not one of my 15, but I do sort of separately keep track of some that are online retailers.
Yeah, so I would love to see it tracked, because I think what's happening in our probably across the country is a lot of the brick and mortar stores are either not doing well or closing down. And it has shifted to the online. We've been told this for years. And I'd like to see, for example, retail, is that all going, is a lot of it going online? The dog food, that those categories. If you can do that, I would love to be able to track that.
Okay, be happy to get you some of that information.
Thank you.
You're welcome.
Councilmember Coombs, any questions?
Yeah, I guess I have a question about the utility point that you made. So utility rates have increased, but you're saying that the total spending on utilities has decreased. So I'm wondering if we have any sense of like, is there really that significant of a drop in energy use that it makes up for the rate increases?
Unfortunately, I don't have that level of detail. I can tell you what we are collecting. So really the total sales from utility have declined. And so it's going to be made up of some combination of amount of energy sold, and it's going to be based on the rates as well. But I don't have like returns from the utilities that tell me which components led to their decreasing total sales volume.
I would definitely be interested in seeing kind of what that overall decrease in volume is, just to, if you can email me or something, just so I can try to understand, given that, again, rates have increased. So it's a little surprising that overall sales have decreased.
Yeah, and to be clear, this was comparing 1 month to 1 month, but what I probably could get you is like year to date, which is, I think, not going to show the same picture.
Okay, that's helpful. Yeah, that would be great. Thank you.
Okay, happy to get that for you.
All right. Thanks, Bill, for the presentation. Appreciate it.
All right. Thank you.
Next up, item 4A, 2025-26 City Pay Table Resolution.
Good afternoon, committee members, council members, and others on the call today. Thank you for having me. My name is Chuck Espinosa. I'm the manager of compensation and classification within the Human Resources Department. Annually, Human Resources evaluates the city's pay table to ensure alignment within our job market, to ensure and drive competitive wages for current and prospective team members. After said annual evaluation, we do propose revisions to the pay table for the next 12 months. Attached here is the proposed pay table, which would be in effect through Q3 2026. Does the committee approve moving forward the resolution for council's review and approval? At this time, I'm also happy to answer any questions.
All right. Thanks, Chuck. Council members Bergan or Coombs, questions?
Yes, I do have one question, which is just that it looks like these are variable hour, but it looks like we do have a handful of positions that are kind of in the vicinity of minimum wage. There's the program assistant, and it doesn't really say what department that's in, but it's, $15.34 an hour. And so I'm just wondering, like, what kind of market information are we looking at such that we feel comfortable having folks at that type of a rate that's down in the minimum wage range?
Sure. To answer a part of that question, what market data do we have? So we utilize a combination of both public sector data, which we gather through a third-party platform, as well as interactions with our nearby agencies, mixed with private sector data for alike roles in the greater Denver metropolitan region. And so these particular ranges, as you mentioned, are closer to minimum wage. Program assistant in the example given is a lower waged role, not requiring any advanced education. For the in commonplace in our Parks and Recreation department, supporting summer programs. So we do feel that the market, that the range is in alignment with the market. Furthermore, individual team members can receive more than the minimum posted amount based on their individual experience, education, or training. So while the minimum of the range may be closer to minimum wage, there are opportunities for individuals to receive more pay based on their respective backgrounds.
Thank you.
Councilmember Bergan.
I'm good, thank you.
All right. And are both of you okay moving this forward to study session?
Yes.
Okay. Thank you. Thanks, Chuck. Appreciate it.
Thank you.
All right. Up next, Career Service Commission overview and update. Pat Sylvester.
Good afternoon, everyone. My name is actually Coombs. I'm filling in for Pat, who's actually out on leave.
And actually, this is Ryan Lance, Director of HR. Candace, if you don't mind, if I can share the screen.
Not a problem. I'll stop sharing.
Sorry, Fazeri.
Thanks, Ryan. So I'll give you a quick overview over the Career Service Commission. So whenever an employee is facing discipline, with advanced discipline considering a suspension, involuntary demotion, fine, or termination, they do have the right to appeal to the Career Service Commission, and only if they have appealed to the department head or a council appointee. So the commission is comprised of 5 citizens as set forth through city charter. And currently we have 4 commissioners that are serving for us in a voluntary capacity for a 6-year term. And we're hoping that the 5th commissioner will be approved through City Council in October. So let's talk about the appeal process. So once an employee, again, has that suspension, termination, or involuntary demotion, and they have the right to appeal to the Career Service Commission, they would do so as set forth in the city's employee policy book. That must be provided in writing, clearly stating what their reasons why they feel as though that disciplinary action should either be reversed or modified. Now, the commission does not have the authority to increase the discipline. However, they do have the authority to either uphold it, reduce it, or reverse the discipline in its entirety. The hearings can be held either open or closed to the public, and that is decided by the commission themselves. And it's case by case, and an example here is a sexual harassment case. They may decide to keep that closed. One of our assistant city attorneys will represent the department who is actually defending the action. The employee has the right to either retain their own counsel or represent themselves. So in 2024, we had 4 appeals that were presented to the Career Service Commission. One through the Housing and Community Service Department for a 1-day suspension. That employee submitted their appeal in March of 2024. However, they did withdraw that in April of 2024. In the Court Administration Department, they had a termination. That employee appealed in April of 2024 and withdrew that in May of 2024. The Award Water Department had a termination that was submitted in October 2024, and that was dismissed by the commission in November of 2024. In 2025, we had 8 hearings that was presented to the Career Service Commission. Court Administration had one for termination that was filed in December. That employee withdrew that appeal, in April 2025. Courts had another termination that was submitted in February of 2025, and the employee reached a settlement with the city in March of 2025. Court Administration had a termination that was appealed, submitted in December of 2024, and that hearing went forward in March of 2025, and the outcome was that the termination was reduced to a demotion. General management had a termination that was filed in November 2024, and that was dismissed in February of 2025. Public Works had a termination that was submitted in January of 2025, and that hearing did go forward in May, and the commission decided to uphold that termination. Housing Community Service had a termination that was submitted in February, and that employee withdrew their termination in July of 2025. Aurora Water had a one-day suspension that was submitted in September, and that one is still pending. Parks, Recreation, and Open Space had a termination that was submitted in October of 2024. That hearing was held in April of 2025, and the outcome was that the termination was upheld, but the commission decided to modify the eligibility for rehire and allowed the employee to be placed on, to be eligible for rehire. Any questions?
I have one.
Go ahead, Councilmember Bergan.
Thank you. So when employees withdraw, why would they withdraw?
Sometimes the exact reason I wouldn't know, but sometimes employees decide that they don't want to go forward with a full hearing, and they decide to withdraw their appeal.
Okay, and then on the dismiss, that you dismiss the whole case, or you're not reversing it, right?
No, the commission dismissed the actual appeal because the employee did not submit the required documents to go forward with the hearing.
Okay, great. Thank you so much.
You're welcome.
Councilmember Coombs, any questions?
Yes. So do we track whether if someone withdraws their appeal, whether or not they subsequently file a lawsuit instead?
I'm not sure. We do not track it here in employee relations, but I'm not sure if the city attorney's office is tracking that. We do not track that, ma'am.
This is Kim from the city attorney's office. It's pretty rare, so I don't track it, but I can speak to those cases and know they did not file subsequent lawsuits.
Okay, thank you.
All right. Thank you very much for the presentation. We appreciate it.
You're welcome.
Next up, item 4C, Ryan Lance, benefits update.
Right. Good afternoon, council members. Ryan Lance, Director of Human Resources. I get the privilege to give you your annual update on the city's benefits package and our open enrollment. So just as a reminder for everyone, we do an annual process that is a thorough review of our benefits program. We do have a benefits team that does review it. We start as early as January and February of every year, and then the renewal process usually goes all the way through that September time period. Our process includes direct communication with executive management, who are the decision makers on a lot of this, as well as we have a benefits committee. We utilize the PACE committee. So we have different opportunities to get employees' feedback throughout the process. This includes collaboration and partnership with both of the bargaining unions as well. So for our 2026 benefit renewals, here's a quick summary of it. This is broken down with the medical, which is seeing a 4.3% increase. I'll go into a little bit more details on that on the next slide. Our dental is at a 3.2% renewal increase. And then no changes to vision. We are making a carrier change to our life insurance and disability carrier. And then that includes adding accident, critical illness, hospital indemnification, and a few other of our ancillary or voluntary benefits. And then, of course, we track consistently our dependent care FSA, our healthcare FSA, and then we do have a whole other package of voluntary benefits. So the major one is, of course, the medical. And for 2026, our medical renewal cost is increasing by 4.93%. We do have 2 medical providers, Kaiser Permanente, and starting in January, we introduced a second medical provider, and that's United Healthcare. So we're still less than a year of having this second medical provider with the city. The good news is, and for perspective, that 4.93% increase is really good. We benchmark data, we use a broker to help out. A lot of other municipalities are seeing, almost all municipalities out there are seeing double digits increases, 10%, 12%. So we're very proud that we are consistently seeing that 5% or less. And we see it year after year. So we feel like we're doing a good job of managing our benefit plans without reducing benefit offerings to employees. So for Kaiser, just a quick overview, we do offer 4 different plans. We offer a high deductible health plan. We offer a deductible HMO called 200 and a deductible HMO of 750. And then we are still maintaining an HMO plan. There is going to be some increases to cost for the HMO plan. We are continuing to work on how we're designing that plan, and really some of our other plans are better plans for our employees. For United Healthcare, we are offering 3 plan options, a high deductible health plan. I will mention, as you see there, it's called Choice Plus. That is our broadest network, and it is our richest network out of all of our benefit plans. With that, there is a little bit of an extra cost associated with that, but it's part of the idea of having choice for employees. And then we have a $750 deductible plan and a $1,000 deductible plan, and we utilize UHC's Colorado Doctors Plan Network. Our high deductible health plan, like I mentioned, has that broad network, and then the other 2 plans have a little bit more of a narrow network. So both Kaiser and United Healthcare, some changes that are happening, these first 2 are initiated by the IRS and federal regulations. They are increasing for a 3rd or 4th year in a row the deductible minimums for high deductible health plans. Now it'll be $1,700 for single and $3,400 for family. The city does contribute to employees' health savings accounts. That's the HSA. With that, though, there are increases that are done by the IRS. They are increasing the maximum amounts that people can contribute, max of $4,400 for individual or $8,750 for family. The city does fund HSA. We put some first dollar coverage in there. For a single, for an employee only, it's $1,200 that the city contributes. For a spouse, or if they're on a children plan, $1,500 or $2,400 for family. And then there are going to be some modest increases to employees' premiums, because as we're seeing a close to a 5% increase overall, the employees will also see an increase to their premiums. So those premiums for the Kaiser plan is roughly 5%, and that is for most plans, with the exception of the HMO plan. And then for the United Healthcare, the employees will see an increase of 15.4% for the high deductible health plan. That's the one that has the Choice Plus network, 3.4 for this 750 plan, and then 2.8 for the 1,000 plan. Here are the Kaiser Permanente
Hey, Ryan.
costs. Yep.
Could I ask a question just while we're fresh on it, so I don't forget?
Of course.
So obviously, you know, I was a big proponent of adding a second option outside of Kaiser. So I'm just curious, what percentage of employees have selected United Healthcare? And, you know, since it's our first year on it, it may not be a good judge, so maybe we need to hear back again, you know, next spring or whatever after open enrollment. But just curious, how many selected United?
We ended up having just over 15% enroll into it. We were projecting between 20 to 25%. I think United Healthcare was hoping to get in closer to that 25%, but they weren't requiring that. So we are seeing about a 15, 16% the initial enrollment. We are seeing a trend of our newer employees who are enrolling at about a 50% rate. So that 15% is increasing month after month as we get new employees. Past experience has always shown that when you introduce a new carrier, employees tend to say, yes, I'm going to enroll on it, but you typically get people who don't want to move away right away. So the numbers are exactly what we expected, and we would probably continue to see people with active enrollments, open enrollment, or new employees. We do feel like we'll probably end up closer to that 20 to 25% over the next couple of years.
Okay. Yeah, I'm not surprised that here that new employees are 50-50 because, as I observed last year, I think Kaiser is controversial. People love them or hate them. So,
yeah.
For people who love them, it works, but people who don't, doesn't. And so, not surprised to hear the split on new employees. And then my other question is on the city's contribution to the health savings account. Do we index that to inflation, the amount that we contribute? Has that stayed flat? Like, what does that look like?
We introduced it about 4 years ago at a average amount that we saw with benchmark and comparisons. We did in the subsequent 3 years, increase it every single year just because it's part of our philosophy to mitigate costs. We are encouraging consumerism, and we think that's a key part of our strategy. And it's a lot higher than what we see with other companies, private sector or public sector. So it's a very generous benefit, but it's part of our strategy that helps us out with annual renewals. This year, we are not proposing an increase, obviously because we're budget conscious with that 5% increase, knowing the 2026 budget situation. But overall, we think we're above, we're leading the market in our contribution amounts with that one.
Okay. Yeah. Glad to hear that. I mean, and that's the context I was asking. I mean, if we keep that amount flat over a long period of time, the purchasing power essentially of that contribution gets less and less. And so I'm glad to hear that we've been increasing it. Councilmember Bergan.
Yes, thank you. Just, talking about United Healthcare, I actually have the Choice Plus. First time I've ever even been on the city plan in my 9 years on council. I chose the Choice Plus, costs more, higher deductible, but for someone who's a prior cancer patient, as well as my husband, it made a big difference because even within the United Healthcare other plans, you really have to be careful because you may end up thinking you can go to your prior oncologist, specialist, hospital, and find out they're out of network. So that Choice Plus gives you that flexibility to continue seeing those, those specialists, those doctors that maybe you want to stay with. So I just want to point that out.
Thanks.
And maybe on that note, oh, sorry. Do you want me to continue?
No. Yeah, go ahead, please.
And on that note, as you can see, and you guys are really astute with benefits, one thing I will point out here is that Choice Plus, as I said, was a little bit more expensive. You could see there wasn't a lot of data that United Healthcare had. They came in with a 21.5% increase, and a lot of that has to do with this Choice network. So we're going to continue to monitor this. We're going to set ourselves up so we can maintain this plan, the Choice Plus, because choice is important for our employees. But here's a list just for the record to show where our rates are going to be for 2026. This shows the total premium, the city costs, and then the employee premiums. And I'll show you a little bit of how this compares to other agencies. I will highlight, we continue to have very, very rich benefits. We're going to continue to maintain that as long as we possibly can. And we are very hopeful that we can continue to responsibly manage this for long-term sustainability. So moving on, I'll show you for the record as well. This is a breakdown of our plans. So I mentioned all 7 of our plans here. You can see we try to offer a very diverse level of coverage. So employees have choice based upon their medical needs, their financial situations, and we'll continue to monitor or maintain this structure here. So in terms of comparisons, I think it's really important to know that we are very diligent on annually benchmarking our benefits to other municipalities, counties, and districts that are out there. We did 36, 37 this year, so we increased it. You could see the list of all the agencies that we got their detailed plans, and we compared it to ours. As we look at the deductibles and out-of-pocket max comparison, the yellow is our combination and average of all other agencies. The teal bar is the city of Aurora. When we look at the comparisons, you could see on the first chart, the high deductible health plan. We're looking at deductibles and out-of-pocket maxes, and you can see our levels are much lower than what other agencies do. So that means our employees pay less for the deductibles and less out of their out-of-pocket. Then you can see in the middle is the DHMO plan. We are substantially lower, so we're offering much better benefits and coverage levels. And in the last column, it's the HMO plan. And you can see our HMO plan is going to be set up a little bit differently. There's no deductible for it. And even our out-of-pocket max is much lower than other agencies. This is key because you'll see we do charge a little bit more for our HMO, but employees pay a lot less when it comes to the deductibles and out-of-pocket max. And then if we're looking at the other key piece of it is, sure, you can have rich benefits, but how much are employees having to pay for that? You could see here, same thing, same agencies, yellow bar are other agency averages, teal is the city of Aurora. When you look at our coverage for the HDHP plan, high deductible health plan, our employees pay far lower premiums for a much richer benefit. You look at the middle, which is our DHMO, we average that out. Again, our employees are paying far less out of their paychecks for much better coverage. And then as I mentioned, the HMO, our employees are paying more out of pocket for the HMO, but they have a much lower out-of-pocket max, and you can see they don't have a deductible. So in its totality, employees pay less even on our HMO plan. So moving on to dental, our dental, we did do a request for a proposal, an RFP. It's a part of our procurement agreements that every 4 years, 5 years, we go through through a dental RFP. Through that, we did have some good interest and some bidders. We ended up selecting Delta Dental to maintain our incumbent. We didn't want to make a change. They came in very competitive. They provided great services, and any type of change would have forced about 20 to 30% of our employees to find new dentists. So considering all those factors, it was a really easy decision to stick with Delta Dental. It is a 3.2% increase, which was in line with what the other finalists were projecting. And then, like I said, we just really valued the partnership we've had with Delta Dental and not disrupting any of the employees. Here is a chart of the costs associated with it. There's a lot of information here. I will just highlight that it is a 3.2% increase to total cost. And we are offering 2 plans still, a base plan and then a buy it plan for our employees. Very competitive plan and very competitive rates. The big one that kind of surprised us is the renewal that happened with our life insurance and our disability carrier. They came in with an 80% rate increase. That was almost a $500,000 increase to cost. And that had to do with the last 4 or 5 years. We did have some high claims. It seemed to be justified, but we wanted to go to RFP. Through that process, we had good interest. We had a handful of bidders that were out there. A couple of them did not bid. And through that, we narrowed it down to 3 finalists. And we ended up going through a selection process. So we are going to be changing from Voya to a life insurance and disability carrier called Unum. That initial increase was going to be a 2.3%, so far less than that 80%, but we did negotiate down to a 0% increase. So no increase to this, but we are having to change our life insurance and our disability provider. Here's a list of some additional enhancements that this company is providing, anywhere from our long-term disability to accident, to critical illness, and hospital indemnification. So we're seeing better benefits that are being offered by Unum. And we also think this will be a better experience from employees. We had troubles with Voya. We did check references, and Unum is going to be a great partner with us. And then lastly, real quick with open enrollment, we are going to do an active open enrollment. This will be the 2nd year. third year in a row that we're doing an active enrollment. We did have 98% of our employees participate. It's been a smooth process. The 2% that didn't were ones who typically didn't or don't have our coverage. Because we're changing life insurance and our disability, this is a best practice to make sure employees are checking and taking a look at their beneficiaries for life insurance, looking at supplemental benefits, and we think this is a good practice for us. We don't plan to do it every year, but because we're changing disability, we wanted to do it this year. And then we do a lot of communication. We'll send out in a mail out to homes, because sometimes the decision makers with benefits are the significant others or their spouses. So that's important strategy that we have. We'll do postcards at home. We'll have open enrollment guides, email notification, and then we do a series of open enrollment presentations for employees. We record things, we have things posted, so there's plenty of information for employees to know what's going on, especially during an active enrollment. So with that, are there any remaining questions that you guys have or comments?
Councilmember Coombs or Bergan, questions, comments?
Just clarification, you said we are doing the open enrollment this year, but don't plan on doing it in the subsequent years. So if you don't do it, like, let's say for 27, then you just keep your benefits unless you say you're going to change something. Is that how it works?
Yeah, no, I apologize. I didn't provide clarification. We're doing an active enrollment, which essentially means in order for employees to continue the benefits, they have to actively enroll in that. Opposed to a passive enrollment, where whatever benefits you currently have, if you don't do anything, they automatically roll over.
Okay,
so we are actually this year. Yep. So to be determined what 2027 looks like, but it could be a passive enrollment where it will automatically roll over.
Okay, great. Thank you. And good job.
Councilmember Coombs.
No questions from me.
All right. Yeah, thanks, Ryan. As I've said before, I really value the fact that the city can provide strong benefits to our employees, and you and your team always do a good job of keeping costs down as much as possible while also still providing rich benefits. So thanks for doing that, and thanks for the presentation.
All right, thank you.
All right, 4D we removed from the agenda. 4E, Nancy Wishmeyer, external audit contract.
Good afternoon. So the city is going to need a new external contract in place for the 2026 audit. And Forvis has, they are a current audit firm. They have provided a proposal for extension of audit services, and that's in your packet. And there are two options, a 5-year contract and a 10-year contract. Both of these options allow the city to lock in audit fees, and we feel that with both of these options, the pricing is fair and reasonable. Now, the 10-year contract has a more favorable fee schedule in that the fees they increase at a lower rate than in the 5-year contract. But also that 10-year term takes out some of that risk and uncertainty that may occur regarding future economic conditions if we were to renegotiate the contract 5 years from now. Also, as stated in your packet, an important factor in the contract renewal is the rotation of key audit firm members. And this is so we get a fresh, objective look at our city finances, our financial processes, internal controls. So Forvis has said that they will rotate audit staff and their management personnel throughout the contract term. It's also important to know that the city has been pleased with the professionalism and the performance of Forvis Mazars. And this isn't to say that our audits have been easy. And in fact, the past 3 or 4 years have been very challenging for city staff. But Forvis employees are very knowledgeable, and they are very well versed in governmental accounting and financial reporting. And this governmental knowledge and experience is especially important given that there are not a lot of top-tier CPA firms in the Denver metro area who specialize in audits of governments and who understand the very unique governmental accounting rules that are issued every year. So given these factors, staff is recommending Forvis's 10-year contract extension as it provides more continuity and stability with a very strong public accounting firm, but it also is the most cost-effective option for the city. Do you have any questions about the proposal?
Council members Bergan or Coombs, any questions?
No, I'm good with the recommendation.
So I have a
I'm good as
question,
well.
Nancy. Yeah, I guess I have a little bit of heartburn on the 10-year option. While I understand offering to switch, the direct auditor as well as their management partner, as I've stated before, it always gives me a little heartburn having long-term relationships with one audit firm and at least not going out to bid to find out what other options exist, because there is the potential for a level of comfort to grow and, not as, I guess, keep sharp of an eye, if you will, on things. So I guess my question is, who else responded? Because unless I missed it, I only saw Forvis's proposal. Did anybody else respond?
No, we went to Forvis and asked them to provide a couple of options on their extension. Back 20 years ago, when we had done this, we had one other firm that responded to our RFP. And looking at the Denver metro area and expanding out a little bit, Colorado Springs and Grand Junction, even Greeley, Pueblo, there are not a lot of audit firms across, let's say, like the top 10 entities or municipalities within Colorado. In fact, there's 4. And they are 4 firms that do a lot of government audits, but many of them are smaller and they are dealing with, the smaller cities like, Greeley and Littleton and Lakewood. There's really only 2 that are being used by the larger cities. So I know it makes sense sometimes to go out and find out who's out there, what would they do, what would they offer in price. But we know the landscape and we know there's not a lot out there. And I would be concerned, I guess, of going out, spending the time, doing the RFP and the interviews and that sort of thing, and ending up with the same firm. Not that that would be necessarily in the end a bad thing. It's just there's a lot of time and challenge with that to end up right back where you're at.
Yeah. Yeah. I mean, and the other piece of it is, while the tenure does give us some certainty, I mean, it does say that if the CPI index increases greater than 5%, they can renegotiate those fees. So I guess that's where I'm hesitant or where I'm questioning is because they aren't really locking in the rates for 10 years. What they're saying is this is what we'll give you unless CPI exceeds 5%. And I can tell you the CPI index, at least over the last, 3 or 4 years, has exceeded 5% very consistently. And so, we're not quite getting a locked in rate for 10 years. We're getting maybe a locked in rate, but maybe not, depending upon what costs and prices do. So what can you tell me, because it doesn't say in here, what is the annual increase? Like, what is the percentage?
So with the 10-year option, it's a 3% increase. And with the 5-year, it's a 5%. Over the first 5 years, that 5-year option is about 100 grand more than the 10-year option within those first 5 years.
Yeah.
I agree. There's kind of a risk either way, because again, we don't know in 5 years what the economic landscape will look like. And we may end up with the 5-year term having to renegotiate at a higher level anyway. But I understand either way, there's a risk.
So and that's one of my questions, because it doesn't really say. So it just says, given the uncertainties of a 10-year proposal, if there's a CPI change greater than 5%, the fees associated with the contract may be subject to renegotiation if this option is selected. So if we select the 10-year option, are they locking in our fees for 5 years, and then after year 5, it could potentially be renegotiated? Or could it be potentially renegotiated after years 1, 2, 3, or 4 also?
Well, I would say it's after the understanding was after the 5 years. I can verify that with our auditor.
Okay. Yeah, I mean, I appreciate, thanks for answering the questions. And so I think based upon everything you said, I'm comfortable with the 10-year option. Could we maybe clarify that? Because to me, then I think it would make the most sense to lock in the rate for 5 years. And then if CPI exceeds 5%, then of course it could be renegotiated. But that would be the only thing I'd want to see clarification on. But otherwise, yeah, I'm okay with the 10-year option as well.
Okay. That's a great question. I will find out and let you know.
All right. Thanks, Nancy. Appreciate it. Are there any other questions?
I agree. I understood it as we were locked in for 5 years, so maybe I misunderstood as well.
I'll clarify.
Great. Thanks, Nancy. Appreciate it. And then, I mean, otherwise you'll bring this forward to a study session, I assume?
My understanding, it's a contract and it goes on weekly.
Oh, yep, you're right. Okay. Would you just mind then maybe following up via email to the committee with the answer to that question?
Will do, for sure.
All right.
Yep.
Sounds good. Thank you. Appreciate it, Nancy.
Sure.
Next up, 4F, Michelle Crawford, internal audit report, Q3.
Great. Candace, do you want to pull up the slides? Thank you. So again, Michelle Crawford, city auditor. And so there should be a PowerPoint, Candace. So just some quick updates on the third quarter. Overall updates for us is currently our audit planning is under the way. So we did our annual survey across the city in August, and we're currently going through interviews right now. There you go. In progress audits in the third quarter, card expense review, that one is now moving into reporting. The facilities project delivery is working on testing, and then the APD body-worn camera compliance is also in the reporting phase. We are planning on starting 2 more engagements here in the next probably month or 2 as those 2 are completed. Overall engagement tracking progress year to date, there's been no changes from the prior report because we've not completed any additional audits. And the same with this slide on our percentage of accepted recommendations. The overall engagement tracking updates, I'm happy to report the police department did work very hard and implement some new policies, which did address a lot of their outstanding recommendations on the firearms audit. So they are making steady progress. And then court administration, you're getting those updates as well. And they've been closing out a lot of their recommendations as well. The next slide is the continuity of operations. So we did do an audit on continuity operations or COOP plans back in 2018. There are several recommendations still outstanding. Part of those recommendations cannot be implemented until departments have completed their COOP plans. And so this graphic just pulls in and shows the green are those that are substantially completed. The yellow are those that there's partial completion. And then the orange are those that are a little bit behind schedule. And I know they've been working with the Office of Emergency Management, but that is the status of those. And then the last site is on courts. And so I know they have a couple measures underway right now. We have extended the recommendation for system controls until the end of November as they're working through some options. And I believe they are also online to answer any questions. And with that, I can answer any questions on the presentation.
Looks like the chair is on hold. Are there any questions?
I have one. You said for the systems controls, that would be done by the end of November?
I am unclear on an implementation date. The court administration is still working through on how they're going to address that audit recommendation. I believe Eric Givens is on the call and may be able to give an update on some of the things they're considering. It's just our system sends out automatic notices, so we kind of push that date out just to give them a little bit more time. And I don't know if anybody from courts wants to speak to that.
Okay, thanks.
Hey, thank you, Michelle, and thank you, council. Eric Givens, I'll be sitting in for Candace for the next 8 weeks while she's out healing. I just wanted you guys to know I briefly talked to Michelle yesterday and kind of gave her an update, and wanted you guys to know that Trina Sparks from Court Services, who is the manager, reached out to a vendor that the city has dealt with before to try to see if they could take on this audit. Once they looked at the scope of the job, they didn't think they were the right fit for the job. So at this time, Trina and purchasing are working together to get an RFP put together where we can put this out and we can get this system audit control completed. I know we started off with 16 items in the audit and we're down to this one. And I wanted council and Michelle to know that we are taking this very seriously and that we're doing everything we can to get off Michelle's naughties list. I think we're getting this started. I think this is moving in the right direction. So while I'm sitting in this seat, if anybody has any questions, please reach out and I'll keep you guys updated on everything that we're going to do.
Thank you.
Any other questions for me?
None that I'm hearing.
Lost our chair.
Yep.
I know you did.
Yeah, sorry. I have none. I don't think that, obviously, our chair, if he's on hold, does not have any.
Okay, well, thank you guys. And I'd also like to extend an invitation out to council. If you guys get an opportunity, come on down to really court administration and hang out with me and I can show you what we really do there. I know a few of you guys have taken us up on this. I know I've seen Coombs in the courthouse before walking around with the public defender. So I'm going to extend that offer out to you again, Ms. Coombs.
Thank you.
Yeah, thank you guys.
And it looks like we're down to the last item.
Actually, sorry.
Go ahead.
Just clarification. So I'm sorry. Michelle, you said it automatically just puts it to the end of November.
So we use our audit system for audit tracking to automate some of the reminders to departments. And so the due date for this one was originally June 30. And so we keep pushing it kind of back. And rather than pushing it to the end of October, I pushed it out for 2 months. So the system, our hope is by November, the end of November, we'll at least know what the process is going to be. And then we can set what we likely think the implementation date will actually be. And so the due date in our system for notification purposes is the end of November because we've extended it again.
Okay, and so the end of November, I guess, Eric, we will have some results at that point.
We're hoping, and I'm going to keep you guys updated. Once this RFP goes out, I'll see where we land on it, and I will keep you guys updated. I can send you emails, whatever you need, and I will keep you guys updated step by step.
Okay, yeah, no, it's obviously if it was due June 30th, it's taken quite a while. So hopefully we get that taken care of. Thank you.
Oh, thank you.
All right, since our chair is missing, I guess I will step in for the last bit. So do we have anything else on internal audit, Michelle?
No, ma'am.
All right, thank you. So next is miscellaneous matters for consideration. Do we have any miscellaneous matters?
We just have the next coming meeting, which is scheduled for November 6th at 1:30 p.m. Does that work for the committee?
Yes, that works for me. Councilmember Bergan?
Say that again. What was the date? Sorry.
November 6th.
I just want to double check. Oh, no, that is the AEDC retreat. So
All
I
right,
will
since we
not be
don't
able to make that
have
one.
Chair
Yeah.
Gardner, let's by email identify
Okay.
a different date.
Thank you.
Awesome. All right. Any other miscellaneous matters?
Okay. Thank you.